Good afternoon, everyone. My name is Margo Greenwood, and I am the academic lead of the National Collaborating Centre for Indigenous Health. Welcome, all of you, to this webinar. The National Collaborating Centre for Indigenous Health is located at the University of Northern British Columbia in Prince George, BC. It is situated on the traditional territories of the Lheidli T'enneh First Nation, and I give thanks to them for allowing us to be here and work on these very important topics on their lands. There are two goals of this pre-recorded webinar. The first is to share the most up-to-date information on COVID-19 and Canada. And the second is to share information on the use of personal protective equipment within Indigenous communities. The National Collaborating Centre for Indigenous Health and the National Collaborating Centre for Infectious Diseases are two of 6 National Collaborating Centres for Public Health that were established in 2005 with funding from the Public Health Agency of Canada. The NCCs are focused on specific topic areas including Indigenous health, infectious diseases, environmental health, healthy public policy, determinants of health, and methods and tools for knowledge translation. We have 2 presenters today. I wish to welcome our speakers, Dr. Yoav Keynan and Dr. Tom Wong. Dr. Keynan is an associate professor at the Departments of Internal Medicine, Medical Microbiology and Infectious Diseases, and Community Health Sciences at the University of Manitoba. He is a clinician scientist, an infectious disease specialist, and member of the Manitoba HIV program. He is also the scientific director of the National Collaborating Centre for Infectious Diseases at the University of Manitoba. This center focuses on infectious diseases, knowledge translation for vulnerable populations. Dr. Keynan has published over 125 peer-reviewed manuscripts with international and local clinical research on respiratory infections. His laboratory research focuses on immune and genetic determinants of immune activation and the role they play in HIV acquisition, progression, and HIV-associated co-infections. He is a leading point of care in serological assay validation and clinical trials for treatment of COVID-19. Our second presenter is Dr. Tom Wong. Dr. Wong is the Director General for the Office of Population and Public Health. He is also the Chief Medical Officer of Public Health and the Chief Science Officer at the First Nations and Inuit Health Branch of Indigenous Services Canada. He was trained in family medicine, internal medicine, infectious diseases, and public health at McGill, Harvard, and Columbia. His public health work includes engagement with Indigenous communities, HIV, hepatitis C, sexually transmitted infections, tuberculosis, influenza, vaccine-preventable diseases, antimicrobial resistance, chronic diseases, mental health, addiction, and health disparities. Dr. Wong sits on multiple national and international committees and has academic appointments at both the University of Ottawa and the University of Toronto. My final slide offers you some COVID-19 resource sites. You will see that we've listed the NCCIH, so the Indigenous Health, the NCC for Infectious Diseases, and Indigenous Services Canada. Each of those entities have websites that contain much information on COVID-19 that is relevant for Indigenous and non-Indigenous peoples across this country.